Senator from Tennessee.
Are we in a quorum call?
We are, Senator.
I ask that we dispense with the quorum call.
Hearing no objection, granted.
Thank you, Mr. President. When it comes to health care access, one of the biggest issues that Tennesseans face is rising cost, especially on prescription drugs. And I will tell you, this comes up in meeting after meeting. Questions about why are pharmaceuticals costing me so much? Now, according to a study by the Department of Health and Human Services, the average drug price increased by more than 15% between 2022 and 2023. Now, that translates to about $590 per prescription. Nearly half of all the medications that were studied saw price increases that outpaced inflation, including some with increases of, get this, over 3,000%. Now, this is unsustainable, and the reason it is unsustainable is why President Trump decided to take executive action last month to lower drug prices for so many Americans. Now, among his actions, the president is taking on a category called pharmaceutical benefit managers, or they're referred to in acronym parlance as PBMs. And PBMs raise prices and limit choices for consumers. When you look at this industry, we have pharmaceutical companies that are manufacturing the pharmaceuticals. You have health insurers that cover the cost of these. You have pharmacies that sell them, patients that rely on them, and in the mix, there are now PBMs. They are middlemen that came about decades ago. They're between the drug manufacturer, the health insurer, and the pharmacies. So think of this as a triangle with the cost of that running around from point to point. Now, PBMs came into play decades ago. Bill Clinton was president when they came to be, and they were supposed to help manage prescription drug costs and benefits for employers. Sounds like a worthy goal. But over time, these benefit managers have gained incredible power over the prescription drug access across the entire country. They determine which medications will be covered by health insurance plans. And I would imagine that many of us, Mr. President, have had something that was prescribed, and then we find out no longer can we take that. There's going to be something to replace it, or it is not going to be covered at all. They also determine the price. Many times we've gone to pick up a pharmaceutical, we've known what the copay was, it was covered, then all of a sudden it's not, and the price jumps, and you're standing there at the pharmacy counter asking what has happened. So then you have to go call your insurance company. So then they say it is because of the pharmacy benefit manager. And then they will tell you, well, the employer is trying to reduce their cost. All of this excuse-itis because they are focused on how much money can they make. Now, this revenue is often linked to the price of the drug, and the PBMs steer health plans toward more expensive options rather than lesser expensive options. They game the system by tying administrative fees, rebate-based compensation, and other payments to the list price of the drug. And to make matters worse, current regulations allow Medicare Part D plan sponsors to contract selectively with pharmacies, favoring PBM's preferred networks that often exclude independent pharmacies that are probably located on the town square there in your hometown. Now, this is something we've seen far too often in Tennessee, and we have realized this hurts those who live in rural and other underserved areas the most. Recently, the Tennessee Department of Commerce and Insurance conducted an audit of a single PBM in our state. They wanted to see, how is this affecting the price of pharmaceuticals in our state? Now, what they found was truly troubling. To the report, the PBM in question forced non-affiliated pharmacies to pay higher rates for more than 550 medications, including some drugs that they tagged as, again, 3,000% more expensive than what would have been the lower cost option. Now, a non-affiliated pharmacy is generally an independent pharmacy. They're not part of a chain. They're not part of that vertical integration of the pharmacy, the physician, the PBM, the insurance company, the drug manufacturer. They are there in your neighborhood. We also saw in this report that the PBM in question repeatedly failed to reimburse low-volume pharmacies. Again, that's probably the pharmacy in your neighborhood. And they, in good faith, fill your prescription, and then guess what? The PBM challenges it and does not pay the bill. So the next time you go to the pharmacy, what do you hear? Oh, this is not covered. We cannot help you. You're going to have to drive 30 miles or 20 miles or whatever to get to one of the affiliated pharmacies, which again, that is one of the big changes. And again, what you're seeing is those that are in underserved and rural areas and use an independent pharmacy, they lose out. Now, we also found that this PBM in question was engaged in spread pricing that allowed them to pocket $30 million. Mr. President, that is one PBM in one state, Tennessee, and spread pricing put an extra $30 million in their pocket. What that means is patients were overpaying by $30 million, plus the inconvenience, plus the acceleration, plus the fact that these PBMs jockey for what they can get in these rebates, and they change what you're allowed to get. And by the way, they do that without ever talking to your physician. Now, when you look at that spread pricing, it's the difference between what the PBM charges the health plan and what they reimburse to the pharmacy. So this is increasing the cost, another burden you bear, of your insurance. That is what PBMs are doing. So President Trump is addressing this issue by directing his administration to evaluate the role of PBMs in raising drug prices. The resulting report should provide an even clearer picture nationwide of the harms that are being caused by these PBMs, these middlemen. And they're totally unnecessary. And in the Senate, we're working on bipartisan legislation to hold the PBMs accountable. And in March, Senator Hassan, Senator Warner, and I reintroduced the bipartisan Patients Before Middlemen Act. Now, this piece of legislation, which we want to get across the finish line and to the president's desk, it would restore fairness for patients by requiring Medicare Part D plans to contract with any willing pharmacy, not just those in the PBM network. That means Medicare Part D would be contracting with your local community pharmacy, the one where you have a relationship, the one where you know the pharmacist, the one where you go in and say, help me with this, explain this medication to me, talk me through this. Also, our legislation would enhance transparency by assuring that PBMs are not limiting patient access to available pharmacy options under Medicare Part D. If your doctor says you need this, and the PBM says, no, we're not going to pay for that, we're going to pay for this one over here, it would give you the right to get what the doctor says is best for you. It would ensure PBM service fees are no longer connected to the price of a drug, discounts, rebates, or other fees. When you hear these rebates advertised, guess who gets them? The PBM. When you hear discounts advertised, who gets it? The PBM. And also, this would create an enforcement mechanism requiring PBMs to pay the Department of Health and Human Services any amount more than the designated service fee. It means they would no longer be able to game the system, get the rebate and the money, pocket it, and you get a higher price. It is far past time that Congress took action to hold these middlemen accountable. I think we should just do away with them completely. It is time that we lower these drug costs for Tennesseans and Americans across the country. With the PBM Act, we know that this will happen. Mr. President, I ask unanimous consent that the next portion of my remarks be placed separately in the record.
Without objection.
Mr. President, 100 years ago this November, the world of American music changed forever. Nashville's Grand Ole Opry hit the airwaves for the very first time. Today, fans across the country know it as country's most famous stage. It began as a small radio show at the National Life and Accident Insurance Company right in downtown Nashville. In those early days, the Opry showcased the dance tunes and ballads that were being performed by a new generation of musicians in Tennessee and across the South. Drawing on America's folk tradition, these artists were pioneering an entirely new genre, country music. Soon, crowds were showing up at the company's radio station, and after moving between different venues in Nashville, they settled down. The Opry called the Ryman Auditorium its home. That was 1943. At the Ryman, some of the music tradition's biggest stars made their Opry debut. Hank Williams, Patsy Cline, Johnny Cash, Elvis Presley, Dolly Parton, and the list goes on and on. Since moving to its current home at the Grand Ole Opry House in 1974, the Opry has welcomed generation after generation of new stars who have stepped into its famous wooden circle and added another chapter to country music's incredible, amazing history. Along the way, the Opry has become the longest-running radio show in U.S. history, reaching millions of listeners in America and across the world with its weekly broadcast. To honor this extraordinary and historic institution, I'm asking for unanimous consent to pass my resolution that congratulates the Opry on 100 years of incredible music, legendary performances, and musical heritage. Here's to 100 more. Mr. President, I ask unanimous consent the Senate proceed to the consideration of S-Res 207, which is at the desk.
The clerk will report.
Senate Resolution 207, celebrating the 100th anniversary of the Grand Ole Opry.
Is there an objection to proceeding to the measure? Hearing none, the Senate will proceed.
I ask unanimous consent the resolution be agreed to, the preamble be agreed to, and that the motions to reconsider be considered made and laid upon the table with no intervening action or debate.
Hearing no objection. Without objection.
Thank you, Mr. President. I yield the floor and note the absence of a quorum.